This episode is brought to you by my fertility awareness programs. Master fertility awareness and improve your menstrual cycle health at the same time. Head over to fertilityfriday.com/workwithme for more information. That's fertilityfriday.com/workwithme. This is the Fertility Friday podcast, episode number 179. Welcome to the 179th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. For those of you who are relatively new to charting your cycles with fertility awareness, and also for those of you who've been charting for a while and have some experience under your belt, I have something special for you. I've created a free video series and I've called it Fertility Awareness 101. Now, in this video series, what I'm going through with you is what is fertility awareness, what is body literacy, something that I always talk about because it's not just about charting, it's also about what you can learn about your body and your health from your charts. I go through the 3 main fertile signs and also how to get started with charting. What do you need to make it work? And what are the best resources to help you on your journey as you get started? So for more information, head over to fertilityfriday.com/FAM101. That's fertilityfriday.com/FAM101 to get your free copy. I'm excited to share today's episode with you. Today, we're going to be talking about sex steroid metabolism, which is really important, especially when you're paying attention to the menstrual cycle, because what you find when you're tracking the cycle is that if your body's having difficulty breaking down and removing hormones from your body, whether those are your own hormones when you're producing your natural hormones, estrogen and progesterone or cortisol, or whether you're exposed to xenochemicals, meaning chemicals from all over the place. And so I figured this would be a really great episode to follow up from last week's episode where we talked about glyphosate and the exposure to toxic chemicals and how it can impact the body, because in this episode we're focusing on the liver and really getting a sense of how the liver metabolizes hormones, how the liver breaks down and gets rid of these different, whether it's exogenous, like chemicals that are coming from outside of us, or whether it's our own hormones that we're producing, how our liver functions and what we can do to support it. I'm especially keen to focus on liver health in today's episode because when you start paying attention to the menstrual cycle, it becomes apparent quite quickly if your liver is struggling to metabolize your hormones or even exogenous chemicals and things that you're exposed to. And so one of the themes that I often talk about in the show is that the first step, we often think liver detox. It means you have to do something or take something to support your liver, which is not necessarily a bad thing. But often the first step you want to take is removing the things that are stressing your liver out in the first place. So I think it's interesting when you think about how amazing your liver is, all of the things that it's always doing for you. And often the first step is just to get out of its way and let it do its thing. But when you're paying attention to the cycle, it can be quite obvious if you're having an issue with liver metabolism, because in addition to having to clear out your own hormones, your liver also has to clear out all of the different exogenous hormones. And so that's one of the things that I support my clients with, whether it's just interpreting their chart and figuring out what is actually going on, what it means, what you're seeing, or once we have a good idea of what it does mean, supporting you to make those changes that you need to make and really start to encourage your cycle to be more healthy and start to see the healthy changes reflected in your cycle. So wherever you are in your journey, if you're just discovering fertility awareness and you're needing support, just gaining that confidence in being able to chart your cycles, rely on fertility awareness as a method of birth control, or optimize your chances of conceiving, or whether you feel pretty confident and comfortable about the charting, but now it's the interpretation part that's got you. You're not sure what you're seeing and you're not sure what it all means, and you really want some support figuring that out. I would encourage you to head over to fertilityfriday.com/workwithme for more information about the programs that I offer. I have a number of programs, whether you're wanting to just set up a one-time session so that we can really dive into your charts and figure out what's going on, or if you're wanting to actually work with me over a period of time, which I love to do because the charts actually reflect back what's happening. So we get this progress report every cycle to really ensure that we're headed on the right track. So again, that's fertilityfriday.com/workwithme. Now let's jump into today's episode. And today I'm very excited to welcome my guest, Colleen Holland, to the show. Colleen is a chiropractic doctor who utilizes a functional medicine approach to menstrual cycle and reproductive health challenges. Combining her functional medicine background and her passion for women's health, Colleen embarked upon her own discovery of healing and reconnection to fertility. She began charting her cycles and completed her certification in the Arvigo techniques of Maya abdominal therapy while pursuing continuing education to deepen her understanding of endocrinology, the microbiome, and reproductive health. Before long, she enrolled in Justisse College to become a fertility awareness educator and holistic reproductive health care practitioner. And now Colleen teaches charting and uses her patients' charts as a valuable diagnostic tool to help women regain their fertility while empowering them with a connection to their cycles and control over their family planning desires. Colleen and I actually recently met at the Justisse conference that was held in August of 2017. So in today's show, we'll be talking about the important role that the liver plays in hormone metabolism and just hormone balance in general and fertility. And so I'm so excited to welcome you to the show, Colleen.
Hi there.
Thank you so much for being here. And so as I mentioned in my introduction, one of the reasons that I wanted to invite you to the show is because we were recently at a conference together, the Justisse conference that was here. So depending on when you're listening to it, the conference was held in September of 2000, not September. The conference was held in August of 2017. And you did an amazing presentation on hormone metabolism and liver function. And the whole room was just grasping at every word. So I really appreciate you being here today to share your knowledge and expertise.
Oh, it's my pleasure. Thank you for having me.
Well, of course. And so before we jump into the topic of the day, I would love to just get a sense from you of what it is that inspired you into the field, into the chiropractic field to begin with.
Yeah, gosh. So when I was younger, I knew I was going into healthcare. I was this, one of those little girls who just wanted to be a doctor. And I was always drawn to healthcare, although I lived a very typical North American lifestyle where my family was very allopathically oriented. And I had a number of illnesses as a child. I was not a very healthy child. I remember actually seeing a gastroenterologist when I was about 13 and having to go through endoscopy and scary things that 13-year-olds it's a lot for a 13-year-old. And so even that being said, I guess it was a fairly average childhood health-wise. I had a number of antibiotics throughout my life, and I ate the standard American diet, which we now know is just not very good. And so it took me a while, but when I was in undergrad, I knew I still wanted to pursue healthcare, and I was pre-med. And at the time, I had one of those strange experiences where I literally fell in my butt. And so I'll describe that a little bit, but I was walking back to my dorm and there was an icy spot and I fell really hard on my sacrum. And about 1 week later in the same spot, I did the same thing. And so I like to think that in order to change my direction, that the universe had to drop me on my butt a couple of times to get my attention. So I wound up being in extraordinary pain. And I went through MRIs at the age of 19, and I had a couple of herniated discs. And a dear friend of mine said, well, why don't you at least come see my chiropractor and she can help you out. And so I did, and that really started changing things for me. For the first time, I could see a way of helping people with health that was outside of what I was starting to lose interest in, because I was diagnosed at 13 with IBS, but there was never any answer for me. It was just deal with it. And so although I looked to medicine for all the ailments I had, I was not getting healthier. And again, when I had the herniated discs, the orthopedic doctor said, well, you're 19. I don't want to put you on muscle relaxers for the rest of your life. And we also have this option of surgery. And I thought, you know what? No. So at that point in my life, really just started looking more toward alternative health and holistic health. And that's when I just started learning more and more about the nervous system and how it controls and coordinates everything in the body and how important it would be to maintain that. And so, long story short, I started into chiropractic school and very quickly settled on the specialty of prenatal and pediatric care because I loved working with kids and I loved working with women during that time in their lives. So that's really what I specialized in and what's been my passion for the last 16 years of practice is really working with women throughout those fertile years and in the early years of motherhood.
Mm-hmm. Well, and then a big part of your journey most recently is jumping into the Justisse College HRHP training, which is why we were at the conference together.
Yes. Yes.
So maybe you could share a little bit about how you came to your decision to add that to your practice. And also, I'm interested to hear how you do intend to kind of blend those two pieces together.
Right. I've had to figure that out as I go along. It's been pretty interesting. There are not many chiropractors who specialize the way I do. And so I don't have any colleagues to talk with about it. There are a few out there, and many of my colleagues do understand the importance of what Justisse teaches because it really falls in sync with the vitalistic philosophy of chiropractic. But yeah, as I was working with moms and babies, I was seeing what was happening to women and how difficult pregnancies could be, how difficult it could be even to just become pregnant. And then in that first year or two postpartum, the challenges that women were having. So in my first year in practice compared to just a few years ago, there was an astronomical increase in more difficult labors, more difficult breastfeeding, colicky babies. So I was seeing the health of women and children deteriorate and decline significantly. And so I started to wonder, what is this? What's happening? And then I had my own daughter in 2003. And with my history of digestive issues and also PCOS and endometriosis, I suffered quite a bit during pregnancy and had a very difficult delivery. I was actually in labor for 5 days.
Is that even possible? Oh my goodness.
Unfortunately, it is. But, I was in great hands the whole time. We tried to have a home birth and it just wasn't happening. So we had to transfer and have a cesarean. And then I was able to breastfeed. Thankfully, I was very blessed with that, but it was very difficult. And then my daughter never slept and she was colicky and then she had food sensitivities. And so I was not only experiencing this myself, but seeing this in so many of the women that I worked with that I had to just stop and say, okay, what's going on here? And what I found was that most of us who experienced this before we were ever pregnant had a history of, less than ideal menstrual cycle health, had maybe a history of contraceptives and endocrine disruption. There were a lot of commonalities. And for the most part, women are just taught, well, if you've got period problems, just take the pill or live with it and come back and talk to us when you want to get pregnant. And so there's really, this story.
Yep.
So, I was a child of the 70s and 80s, and that's all that was available. I actually diagnosed myself with PCOS when I was 20 because the OB-GYNs that I was working with, they just really didn't have any idea. And the only thing they had to offer me was synthetic hormones. And so it all kind of pieced together. And I think everything happens for a reason. I think all of my life's journey happens for a reason. But I realized that I probably need to change my focus in practice and try to help women become more healthy, more robust in their menstrual cycles, help them understand how important it is to ovulate and make their own estrogen and progesterone each cycle, because that helps them long-term for their health, but it also helps them when they're ready, if they desire to have a pregnancy and a healthy baby and a healthy postpartum. And motherhood and parenthood, it's all a challenge. But if you have the added burdens of, hypothyroidism and irritable bowel and a colicky baby and low milk supply and on and on and on, so many families are suffering. And I really do believe that the commonality or the reason why this is happening is because we are never taught the value of our menstrual cycles, and we are never taught to prioritize the health of our menstrual cycles. And we don't even think about them really until we want to become pregnant. And by then we could be 10, 20 years into no ovulations or few ovulations and very little progesterone and not our own estrogen. And then we expect our body to form a healthy baby.
Mm-hmm.
And it just doesn't work that way.
I couldn't agree with you more. I really appreciate the way that you put that out there. And that's why I always ask what brings you to your profession and the path that you led, because I find it to be very interesting. And as a woman, and I've talked about this so much on the show, just the way our society views our menstrual cycle, or rather doesn't, it's almost just like another thing. It's really disempowering us and setting us up for a lot of interventions.
Mm-hmm.
So I'm resisting the urge to go into a huge tangent. You opened the door for me, Colleen, but I'm resisting the urge to take the bait. But I just really want to iterate that. And so for anyone who's listening to this episode for the first time, I mean, the podcast just contains so many different episodes to really get at how important the menstrual cycle is for overall health. It's a good segue into the topic of the day, which is steroid hormone metabolism and liver function, because ultimately it really comes down to the menstrual cycle. When you're watching the menstrual cycle and monitoring what's happening throughout the whole cycle, so not just your period, but throughout your pre-ovulatory phase, assuming that you're ovulatory, and then your post-ovulatory phase, that gives you a really good sense of what's happening hormonally and what's happening even just in the basic comparison between your estrogen and progesterone levels. So maybe we could kind of start there. And so I'll leave it to you, Colleen. Maybe you could share even just connecting the menstrual cycle to our steroid hormones and then leading us into a conversation around it from there.
Sure. Okay. So as you know, it's important that we produce our own estrogen and progesterone. Not only do we want to produce it in the amounts we need to sustain a healthy ovulation and healthy menstrual cycle, but we also want to then be able to metabolize those hormones when we're done using them. Because if they were to build up in our system and hang out old used estrogen and progesterone, it doesn't do us any good, and it also actually is not ideal to have that hanging around too much. Our cells have receptors for these hormones, and if the receptors are getting bombarded with metabolites or breakdown products of old estrogen and progesterone, that's going to be very confusing to our endocrine system. And so we talk a lot about having to make enough progesterone and make enough estrogen. And we don't often talk about how important it is also to metabolize and excrete those once we're done needing them. Because our cycle is just that. Every month, we start a new cycle. We want a fresh lining of the endometrial layer. We want a fresh set of hormones, because the whole purpose of the menstrual cycle is to potentially create new life. And our body wants to give that new life the best possible chance. And so when we get rid of the old and renew, it's a pretty interesting metaphor, really. It's just this renewal process. And I think it's actually a wonderful part about being a woman, is that we get this ability to cycle through and renew each month. And whether our intention is to have children or not, to never have children or to have them 10 years from now, it doesn't matter. Our body is there doing for us this amazing process. So when I get excited and hyped up about estrogen metabolism or sex hormone metabolism, it's because really there is, in our society, there's a lot of deficiency in our metabolism. And that's what can cause a lot of the problems that we see women going through. And I just want to pause and just recognize that there are so many women, probably many of your listeners, who have or are suffering because hormone metabolism is not ideal. And we live in a world where, unfortunately, we are the canaries in the coal mine, and we are exposed to so much more than women generations before us have ever been exposed to, as far as xenoestrogens and just all kinds of other estrogen mimicking chemicals that can wreak havoc on our endocrine system. So really what gives me pause and what continues me to just shout from the rooftops is that women are suffering. They're suffering. And you can help them with your information. I hope to help them with my information. And we can talk about how the body goes through and metabolizes estrogens and what sorts of things get in the way. I know that a lot of people work with holistic practitioners, and I think it's wonderful that we have access to these practitioners now. The standard tests that we've had in the past, many tests look at what our hormone levels are. So we look at saliva tests and we look at blood tests, and those are all valuable, but actually they don't tell us how we are breaking down our hormones. And the reason why I want to emphasize that is there are certain tests. There's a test called a urine metabolites test that will look at how we actually break down those hormones, and how we do that and what intermediate breakdown products are floating around in our system are all very important information to know, more than how much estrogen or how much progesterone we have at any given moment. So I'm not sure where you want to go. I have a lot of information up in here. And I don't want to be aimless.
Well, let's start at the very basic level without going into like a ton of excessive detail. I mean, from what you've spoken about so far, we can start with the idea that in our menstrual cycle, the two main hormones that we are paying attention to are estrogen and progesterone. Mm-hmm. And those are steroid hormones. And so maybe we could start just by you telling us, what is a steroid hormone? And what are they made of?
Okay, great. Yeah, so steroid hormones are they're made of cholesterol. So we have to have enough dietary cholesterol. We have to have enough cholesterol in our body to be able to make the hormones that we need. Now, other types of hormones are protein hormones, but sex steroid hormones are made from cholesterol. So we have the two different branches of hormones, protein-based and cholesterol-based. And from there, we actually have a bunch of different steps to be able to make our estrogen and our progesterone. Some of the cholesterol is then transformed into testosterone, some into estrogen, some even into cortisol. So the liver and the gonads and the adrenals and even the placenta when we're pregnant all help to take the cholesterol and form them into the various sex hormones.
So these tissues then are taking cholesterol and synthesizing hormones from them throughout our body.
You got it. Yes.
And you touched on the importance of fats. And so recently I released an episode with Sally Fallon Morale. At the time that we're recording this, Colleen, it has not been released yet. But at the time that this is released, it will have been released already. And so in that episode, she talked about, the difference between animal fats and plant fats and and the important role. So I think that I always want to highlight that in order for our body to make hormones, it requires cholesterol. It requires some sort of animal fat in the equation.
Right. Yes. And Sally is the expert on fat in the body for sure. I wouldn't even, I'm excited to hear her podcast. You've had her on before, haven't you?
Yeah. Okay. She was one of my first. And she recently released her new book, Nourishing Fats. And so I wanted to talk to her about that.
Excellent. That will be one I will add to my library.
Well, and what I also find to be very interesting about the way that our body creates different hormones, so before we get into the metabolism aspect of it, is the relationship between different hormones. And so maybe you could touch on that a little bit. So we start with cholesterol, and of course, we're not going to go through all of the different hormones that are produced, but even the relationship, say, between progesterone and cortisol, or just so that we get a sense of how our body kind of converts these things and the relationships between these different hormones. Yeah,
it's actually fascinating because we can take pretty much anything and make it into something else. So we can actually turn testosterone into estrogen, and we can turn progesterone into cortisol, and we could also turn progesterone into estrogen. And so our body is amazingly adept at being able to take whatever materials it has and create whatever our body needs. So interestingly, because I mentioned cortisol, when we are under high amounts of stress, and we all have heard that stress can really wreck our menstrual cycles and it can make it so that our endocrine system's all wonky. The reason being is that because cholesterol and progesterone actually have the same precursor. So once we take the cholesterol and then we make it into something actually called pregnenolone, then that can be made into either progesterone or cholesterol. And when we have a high demand for cortisol, when we're under pretty high stress, that's very consistent. Our body will use that pregnenolone to preferentially make cortisol, because it's what our body needs. If we're under that kind of stress, your body is, running away from the lion, and it has to create the cortisol to keep the blood pressure up and keep your blood sugar available for the skeletal muscles. And so when we're under high stress, instead of making enough progesterone, we will make the cortisol and really not have enough progesterone for a healthy luteal phase, which affects women in a number of ways. It can affect them in a way of having them have PMS symptoms. Low progesterone often causes PMS symptoms. And many women are told that that's normal, that they get PMS symptoms, headaches or irritability or bloating. And it could just be that they need to do some stress reduction. Mm-hmm. We also see shorter luteal phases when there is lower progesterone in the body, and that can make it harder for them to get pregnant or to maintain a pregnancy. So also even just premenstrual spotting can be a sign that progesterone is low. And so many women in this day and age are not even aware of how much stress they have in their body until we look at their charts and I say, what is going on? What
happened on this day?
Yeah.
What happened on this day?
Talk to me about this. And until they're actually asked to think about it, they don't think they have any stress.
Yeah.
Yeah.
Well, I'm really glad that you brought that up, because that was one of the questions that I was excited to chat with you a little bit about, because from our perspective as fertility awareness educators, our primary tool then is the menstrual cycle chart. And the chart gives such a wealth of information about what's happening. And there's also different ways that stress seems to impact the chart in the pre-ovulatory phase versus the post-ovulatory. So before you ovulate, your body isn't pumping out very much progesterone compared to what it's pumping out after you ovulate. And so stress in the pre-ovulatory phase affects your cycle in different ways, often delaying ovulation. Mm-hmm. Whereas in the post-ovulatory, like you mentioned, there's all these different things that can happen. And so I think for a lot of women who start charting and working with someone like you or I, who's kind of pointing all this stuff out to them, it's that first time that they realize that there's this very tangible and obvious way that stress can impact their body. And the stress doesn't have to be their boss yelling at them. It could be eating food that is terrible for you, food that you're sensitive to. So we think of the word stress as this emotional thing, but stress on the body is not just that. So I think it's really important then, that whole concept that, yeah, if you're really stressed out, your body literally will take progesterone and make cortisol with it.
Yes. It's actually called the pregnenolone steal. And so pregnenolone is the precursor to progesterone and estrogen and cortisol, to all the hormones, all the sex steroid hormones. And so when you're under extreme stress, whether it be emotional or physiological, like you mentioned, then what happens is called the pregnenolone steal. And so that pregnenolone is then shunted toward the production of cortisol, and you just won't have the other hormones in the levels that you need.
Mm-hmm. Well, and I'm sure that's not the only reason for a short luteal phase, but that's something that we would really want to pay attention to. So let's talk a little bit about the liver then, and the role, because I know you mentioned that hormones are metabolized in our body in different locations, but let's focus on what is happening in the liver in terms of hormone metabolism, from the creation of hormones to the breaking down of hormones.
Mm-hmm. Sure. So the liver does so much in our body, and it's one of the underappreciated organs, I would say. It really is responsible. If you were without your liver, you would not live very long, which is why it's very serious for people who, are awaiting liver transplants, because the liver literally does so much work for the body, not only producing and breaking down hormones, but even making proteins and enzymes and all kinds of things that make our physiology work. And the importance of the liver can actually be seen if you look at the blood volume for every beat of your heart. 25% of that blood volume goes to the liver. Yeah.
A quarter of all your blood.
A quarter of all your blood at any given moment is going toward your liver. The brain gets 15%, just for comparison. So, and then the kidneys actually get 20%. Which is surprising for a lot of people. But if you think about it, the liver and the kidneys are organs of elimination. And our body prioritizes elimination fairly significantly. As you can see, 45%, 25 to the liver and 20% to the kidneys. So 45% of our blood volume at any given moment is going to those two organs. So I think that's one of the things we'll probably talk a little bit about later is just about excretion and how important it is to keep all those channels of excretion open. There's a book, I can't remember who the author was, but I remember the title is called Detox or Die. And it's fairly true. I mean, we really do need to be detoxing all the time. And that's why our body focuses on detoxification, because if we have a buildup of toxins or buildup of just things that we don't need anymore, then our body can consider them toxic if they're hanging around when they should be being eliminated.
Well, and one of the things you mentioned a little bit earlier on was just how many women have issues with their hormone metabolism and how that is one of the reasons that a lot of us are struggling.
Mm-hmm.
And so let's break that down a little bit more specifically. I suppose maybe you could talk to us a little bit about how our bodies are supposed to work. So what happens when things are happening the right way, or at least the optimal way? And what does it look like, I suppose, when our metabolism is impaired?
Sure. So how well our liver works is dependent upon a number of things. How burdened it is, how much it has to deal with, how much help it gets from the rest of our body, because you'll probably be interested to know, the liver is very much connected to the intestines, and there is a blood supply that goes directly from the intestines to the liver called the portal vein. And the portal vein carries everything from the intestines straight to the liver before it goes anywhere else in the body. And so the function of the GI tract and the bacteria in it and the balance of the bacteria in it are going to determine how much help the liver gets. So the liver has helpers throughout the body, and there are rate limiting factors. So the liver also is having to deal with any excess blood sugar that you might have, because a lot of blood sugar floating around in the body is not a very healthy thing. It's very damaging to the arteries. And so it makes sure that the blood sugar, if there's excess and it's not being put into the cells and utilized, that it turns it into fat, essentially. So we store it. So the liver is kind of like the multitasking mama of the century, just handling everything that is given to it. So the reason why I mention that is because it can only work as well as its helpers and how well it can keep up with the demand. So when we utilize things like perfumes or chemicals to clean our homes, or we drink wine regularly, or even for some people, caffeine regularly, it can be really hard on the liver. And then if our diet is not so great and our microbiome in our gut are just not as healthy as they could be, then they're not there to be able to help the liver as much. So the liver's like, all right, I got to do that job too. And so really, it's the clearinghouse of function in the body and making sure that everything maintains a status quo. And so, we're familiar with the metaphor of the camels, the straw on the camel's back. And so the liver is really the camel. There are many things that we can do to lighten that camel's load, and we can talk about some of them. But I just want to be clear that there is this interconnectedness between the liver and other organs of the body. And it does require some help. And I keep going back to the GI tract because there's such a strong connection there. And one of the reasons why we often recommend people clean up their diet to improve their hormones. Mm-hmm. So that bacteria in the gut actually help us metabolize those hormones.
Mm-hmm. Well, and I'm really glad that you brought that up because I think it's so interesting and trendy to talk about doing a liver detox and that idea that you're going to take stuff that's going to detox yourself when it would seem as though the best thing you could do would be to stop bombarding your liver with stuff. So instead of like going and buying a fancy detox protocol, how about you stop spraying your body with perfume every day?
Right. That's a very novel thought there.
Yeah.
Yeah.
And it's incredible. You know, I'm certain you've seen this with your patients over the years and your clients through your HRHP work, but it is incredible to see the difference that can be made in the menstrual cycle simply by cleaning up not only your diet, but also your home and your household products.
Mm-hmm. Enormous. Yeah. And I ask about those things in my intake form, and people are always a little like, why are you asking about perfume or makeup or, filtered water and that sort of thing, and there's a method to my madness because all of those things are more straws on the camel's back. And if they're easy enough to replace with something that's not going to be a burden, then all the better.
Yeah. Definitely. Well, and one of the things that you spoke about in the presentation that you did at the Justisse conference was the important role of nutrition to support the liver's ability to metabolize. So maybe you could talk a little bit about that, just the nutrients that we need to help our liver do what it needs to do.
Sure. So many of the little physiological chemical reactions that have to happen in order to both make and break down or metabolize our hormones require enzymes. Not only enzymes, but coenzymes. And coenzymes are usually minerals or vitamins that we get from our food. So we need enzymes for these reactions because what enzymes do is they make it easier for the reaction to occur. So I'll get just a little bit technical here for a moment, but if we have a reaction that we want to take place and it needs a little bit of energy, what the body does is it pairs it with a very spontaneous, easy to happen reaction that allows that reaction that we want to happen to utilize the energy of the spontaneous reaction. And that's what enzymatic reactions are. They're catalysts, making it easier, lowering the energy threshold for that reaction to happen. And so when we have the enzymes that we need, great. When we have the coenzymes that we need, wonderful, which means that we need to have those B vitamins and the magnesium and all the different minerals and vitamins in order to make all of those reactions happen smoothly. If we're missing some or we just don't have enough of something, I know you've talked about methyl genetics, MTHFR genetic issues. That's a big issue for people when they don't have enough B12 or B9, which is the folate, then they have a rate limiting factor there and they're not going to be able to metabolize as much because they just don't have the materials that they need to be able to perform the reactions. So if you're not getting the nutrients in, you're literally not eating them, that's one issue. If you're not digesting and absorbing them, that's another issue.
Mm-hmm. Well, and so for those of you who heard Colleen say MTHFR and are like, doesn't that sound like a swear word? Like, what are they talking about? In episode number 54, I interviewed Diane Keddy. We went into MTHFR, and essentially it's a gene mutation that impairs your body's ability to metabolize. So for more information, just definitely check that episode out. But so going back to your point, Colleen, not only are nutrients important we all kind of know that nutrition is important, but specifically in order to facilitate and help our liver to produce hormones, to break down hormones, but also to detoxify. So to get out some of those toxins that we're exposed to, if we're not if we're not eating enough of these nutrients, then that is going to prevent our body just from being able to do its basic work at the optimal level.
Yes, and it becomes stressful on the body and stressful in the system, and again adds to the burden to the camel's back. And so just cleaning up the diet and helping. Usually when we clean up our diet, we actually help our body, our GI tract, to absorb better. So we get some better nutrients, not only just in our GI tract, but into the bloodstream where we need them, because we can absorb them through the intestinal tract. So yeah, just that's really important, not only that we're getting them into the body, but actually able to absorb them as well. And when we clean things up, we usually reduce inflammation in the GI tract. And so that literally makes the walls of our intestines better able to absorb nutrients.
Well, and so from a practical standpoint, if a woman is listening and her liver metabolism is impaired and her hormone production is a little bit impaired, maybe you could tell us or paint us a picture. What does this look like? How would you know? So if someone's listening to the podcast and they're thinking, well, this is all nice, but how would I know if this could be me?
Well, I've never seen someone with liver impairment who does not have something off in their charts. So you're usually clued into something going on there with the charts. Sometimes you'll see mucus, cervical mucus, even after ovulation has occurred, and that can tell you that they're probably not metabolizing their estrogen very well, which means that it's likely that their liver is a little congested. And then if we do lab work, we can also see that the liver is congested with liver enzymes in something called a comprehensive metabolic panel, which is one of the very basic lab tests that you can get with your blood. And there are ALT liver enzymes, and you can see those elevated, but they will take a while to elevate. So you might see someone in earlier stages of liver congestion, and those liver enzymes may not be elevated. But if they are, then that probably means it's been going on for a while. You can also see sugar dysregulation as well, and that's a tip off that the liver might be suffering some. Abdominal weight, adding abdominal weight, fatigue. If you're suspecting someone's thyroid is kind of going south, all of these things are a cascade of dysregulation, liver congestion, maybe less than ideal GI health. So any one of those things can cause the cascade. And usually by the time we're seeing someone, or we're seeing it in their charts, or I'm seeing it on their labs, it's been going on for a while.
Mm-hmm. Well, and so we've talked about a couple of the things we can do to lighten the load in a more general sense, cleaning up the diet and getting rid of some of those chemicals and different external factors. But what are some of the more focused ways that we can just improve liver health, improve liver function, and support the body in metabolizing hormones?
Sure. So really simple things. Just drinking enough water every day is a very simple thing. Movement also, just getting the lymph moving the body. Sweating is a wonderful way to detox. And I'm a huge fan of infrared saunas. So if you have access to an infrared sauna, do that. Otherwise, just get out and sweat, like move. And sweating is just a great way to help. It's just another channel to keep open for your hormone metabolism and really excretion of any toxins. Clearly the obvious stuff, avoiding fragrances and chemicals that you just don't need in your home, switching to maybe some essential oils if you really like something to smell pretty. The other thing that I really want to mention that unfortunately is so very, not just acceptable, but almost encouraged in our society is the drinking of alcohol. Many women, there are so many memes on Facebook about, mommy's sippy cup and it's a bottle of wine. And, there's so many little jokes about having a drink. And there's almost this expectation that in order for a woman to take care of herself, she needs to go and have a drink with her friends. And alcohol is a very heavy piece of straw on the camel's back. And when the liver is already struggling or the GI tract is not ideal, alcohol is just more fuel to the fire. It's not popular to talk about or address because it's so very popular to encourage drinking of wine, and after the kids are asleep, get your glass of wine. But it is something that I really do think impacts women's health in a very negative way. And I know it's a hard thing because that's the way people unwind. So in the morning, they need their coffee, their caffeine to get going. And at the end of the day, they unwind with their glass of wine or their beer or what have you. But I just want to bring it to women's attention that it's not doing you any favors. It's really adding fuel to a dysfunctional fire. And if you have any concerns about your cycle, if your cycle's not falling within healthy parameters, if you're not feeling well, if your gut's not great, or you're tired, or your thyroid's not working as well as you'd like, and if you are still drinking alcohol, you may want to reconsider. It's something that needs to be addressed, and it's usually one of those truth bombs that I have to bring up in a session. As far as caffeine goes, some people can do okay with it. The more congested your liver, though, the less okay you can do with it. So caffeine is not without its problems as well. So I hate to be the bearer of bad news, but I do need to mention those two things.
I'm curious about if you could give us some more info. So what does caffeine do to the liver? Like, why does it contribute to congestion in a more obvious way than other insults? Is the word I was looking for.
Yeah. So caffeine is a stimulant, as we know, which is why we drink it in the morning. But it is, like anything else, needs to be broken down by the liver. And some people genetically have a little bit harder time breaking down the caffeine, and you usually know who you are because you can't drink caffeine past a certain time of the day. Otherwise, you're not going to be able to fall asleep. And so if the person is going through a lot and their menstrual cycles are really off, caffeine is just another helping of burden, really. So it's another thing that the liver has to metabolize. And can you have a cup of coffee every few days? Most people can probably get away with that. But if you're really sick and you've got a lot going on, if you can, you'd be much better off without it. Just lighten your load everywhere you can.
And same question with wine. Do you have any insights in particular as to why alcohol makes such a significant impact in terms of liver health?
Sure. So alcohol is toxic to the body, and it needs to be metabolized and gotten rid of by the liver. So there's the direct relationship there. Alcohol also raises blood sugar. So in another way, that it also adds another burden onto the liver. So it has to then handle the excess sugar in the body. And it's a sedative, which is why a lot of people like to have it at the end of the day. And so it's just one of those things, again, another burden. I'm trying to think of really chemically or molecularly what else it does. And of course, I'm running a blank right now, but it's just another thing, another weight on the camel's back.
Well, and my understanding with alcohol has always been, like, because you mentioned that it's we all know it's not good, but it's toxic to the body. So whereas, like, I'm trying to think of a separate example, but like, whereas water, like, sure, enough water will kill you eventually. Like, alcohol, it's just not the same thing.
No.
So my understanding is that the liver prioritizes excreting alcohol over everything else. Well, the liver never sleeps, like you said. The liver is just working all the time. And so when alcohol is introduced, whatever it is that the liver was working on is put aside to get rid of the alcohol so that you can continue to live. One of the things that I really appreciate about working with women and working with the menstrual cycle, so having access to that tool, is that I find that I don't really have to be the one to say a whole lot when I'm working with clients, because ultimately your menstrual cycle will tell you. So if anyone's listening and you've been charting your cycles, it's quite an easy thing to do to, you know, if you happen to fall into the category of drinking wine every night and you're of the opinion that it doesn't really make that big of a difference, you could be right. And so my suggestion is to give it a try. So do a scientific experiment, N of 1, cut out the alcohol completely for one full cycle. So from your first period to the next one, and then add it back and see what happens.
Right.
Because what I found, and I'm sure I'd be interested to hear what you found as well in the practical application of these pieces of information that we're sharing in this interview, is that when you really look at these factors like caffeine and alcohol, and you compare the cycles between one cycle where you're just doing your normal drinking and consuming of these products, and then another cycle where you're not, you often see some very obvious, stark differences between the two cycles.
You do. Yeah. And at the point you make about allowing the chart to speak for itself, that is so true, because I can tell someone you need to stop drinking, but if they they see it in their chart rather than hear it from me, it'll be much more powerful. And so it's just a gentle sort of thing, like, Okay, here's the last frontier we haven't addressed. And so what would you think about doing one cycle without? And yeah, it's you can see it. And so you may be one of the lucky people who have incredible genetics and incredible microbiome and wonderful health, but usually you're not going to be the kind of person who has that and is talking to you or I, seeing us as clients.
Well, and I think the challenge is that neither of us are saying that alcohol is something that no one should ever drink. Really it's more posing the question of what is optimal for you right now.
Hmm.
And so it depends on what's happening for you right now. So if
Hmm.
right now you have some specific struggles, fertility challenges, and that's why you're tuning into the podcast today, it may not be that alcohol is this thing that you should never ever drink for the rest of your life. I mean,
Right.
I drink alcohol sometimes. I'm just going to put that
Hmm.
out there. But with that being said, it may not be optimal for you for at this point in time. With that being said, there were several years where I drank no alcohol, pregnant, breastfeeding. So because it wasn't optimal for me at that time.
Right.
So,
And everybody's going to have their own preference. Some people will say, I'll do without alcohol, I get things back on track, and then I'll add it back in. And that is perfectly up to each individual woman. And, some women will say, you know what, I'm prepared because I want to have that glass of wine every weekend. I know it's going to give me a migraine right before my period, but I'm willing to do that because I really enjoy that glass of wine. And again, that's totally her call. It's just she knows what it's doing, and she knows how to modulate it so that it doesn't become too difficult for her. And choices are choices. They're individual and personal.
well, and what I love about the example that you gave is that in that situation, that woman is practicing body literacy. So she fully is aware of what's happening in her body. She's
Hmm.
tracked her cycles. And so she's already aware. She's done the experiment. So she knows what happens when she drinks alcohol and she knows how it affects her cycle. And so she's making that conscious decision, knowing exactly how her body responds to it. And that awareness also has probably tempered how much alcohol she drinks overall. So
Hmm.
knowing that reaction, she's probably a little bit more just intentional about when she adds it in and when she drinks it, as opposed to the way that most of us live, like BC before charting.
Right. I like that.
Whereas before charting, you just did whatever and had no idea how these things were affecting your body. After you start charting, all of a sudden you really start to have that empowerment piece where you can actually make those decisions in an informed way, knowing exactly how your body responds.
Right. Right. Yeah, I love that. I love that. And I love the body literacy. The BC thing cracks me up. It's so true, though. It's a perfect way to describe it. I think every practitioner who practices functional medicine or a functional nutrition approach, if they don't go through a training to learn how to read charts, I think they should pair up with someone who does, because the amount of information that you can get, diagnostic information, and save hundreds, if not thousands of dollars on expensive testing that can not even give you as much good information as you can get from a chart. It's phenomenal. And for women to learn that skill is just such a gift.
Mm-hmm. Well, and as we bring our interview to close today, we've talked about so much. I'm really happy with what we've covered, and just to talk about some of those high level roles and important things that our liver is doing for us, but also really breaking it down to the practical aspect, what we could do. Maybe the question I should ask is, in your own practice, what have you found to be kind of the most powerful application, or more so, maybe I should ask, what do you find yourself saying the most to clients who have challenges like this? Like, what is the thing that comes up over and over again, or the thing that you found with clients that makes the biggest difference in terms of improving their hormonal health?
Mm-hmm. I think the biggest thing is having women recognize that they're worth this knowledge. We've been taught and conditioned and raised in a culture that teaches us to stay in the dark about our bodies. And I think the biggest thing, and I'm sure you can see this too with your clients, is this coming into their own body, because it changes everything. It changes how they allow people to treat them. It changes their interaction with their healthcare providers. It changes the way that their relationships with their partners and their family members. And it also changes the way our younger generations are taught. And so no matter what the woman is going through, if she can embody herself, she is going to benefit from that tremendously. So as far as, what do I find myself saying the most? I feel like I'm affirming for them every time I hear them make a connection about their charts and their bodies and make a decision about what they're going to do based on what their body is telling them. I want to let them know how important that is. Like, what a great thing you're doing for yourself. And look, now that's your default. Like, you're important and your body and what it's telling you is important. So I know that's a very vague answer, but it's hard to put my fingers on it, but really just encouraging women that they can understand their bodies and they can use that information and feel really confident in it. Because everything we've been taught from young age is that we should not feel confident in our bodies. We're taught to fear our bodies. We're taught to be afraid. Do we smell? Is that normal? Does my vulva look right? Is my clitoris supposed to look like that? Is all of this embarrassment, and to know our bodies and to feel confident in it and gain that, that's what changes the world.
Mm-hmm.
It really does.
Well, and to add to that, to your list of all the things we're told about our bodies, this assumption, this default idea that our bodies are broken and they don't work. And as soon as something happens outside of what we would consider the normal parameters, that just means that there's something wrong with our bodies. I feel like one of the biggest things with switching to the idea of body literacy and understanding your menstrual cycle as a reflection of your health and as a vital sign, as I talk about all the time on the show, when you switch to that mentality, you no longer have to worry if there's something broken or wrong. You can instead look at the signs and symptoms that your body's telling you and showing you as just your body's way of communicating with you. Mm-hmm. And by responding and observing and paying attention to those signs, all of a sudden now you're in dialogue with your body. Mm-hmm. And so although this dialogue doesn't happen in words, you drink the alcohol and then watch how it affects your cycle. And then you don't drink the alcohol and you watch how that affects your cycle. And voila, you are in dialogue with your body.
Right. Yes. Whether you like it or not.
That's right. And you were in dialogue before. It's just that it was like one way because you weren't listening.
Right. Well, and you can go through your life feeling, and I've suffered a lot with menstrual problems in the past, and you go through your life feeling like, oh, this is my punishment for being a woman. I've heard that so many times. It's so painful, like that's suffering that I talked about earlier. It's just, there's so much suffering. I really want to point out that, we can talk about how so many things can make things go wrong. We could talk about how we can burden our liver, and we can talk about how we can destroy our gut, and we can talk about this and that, but really our bodies are meant to work for us. The reason why we put most of our reserves into our organs of excretion is because our body prioritizes keeping us healthy and well, and it is always working for us. That is the vitalistic philosophy that I got from my chiropractic education and my chiropractic career that I value so greatly, because you can see all the doom and gloom and you can point it out and you can learn the biochemistry and it can sound awful. But really, when you really stop to think about what the body is doing physiologically on every moment to preserve our health and to keep us as balanced as possible, you can't help but be in awe of it. Mm-hmm. And so the liver in particular, like, just put your hands on your liver and just say thank you. It does so much for us. And every good thing you do for your liver is going to be rewarded many times. Your body's just going to use that and just go to town and make your health a priority and make your body a healthier place. So I don't want to end in a doom gloom sort of way. There are many things that affect our bodies. Yes, we live in a world that is not nourishing to us, but we have the opportunity to make so many choices that will help our bodies, and our bodies are just doing everything they can for us. So thank goodness. Mm-hmm. Thank goodness.
And thank you, liver. I'm thanking my liver right now. Thank you. Oh, well, Colleen, obviously I could talk to you all day and
Yeah.
then the next day and a couple weeks
Uh-huh.
continuous until after that. That would be a lot of fun. But I do have to respect your time today. So if the listeners want to learn more about you, or if the listeners happen to, maybe you could share where you're located in the world in case any of the listeners are local and they want to connect with you, and also
Sure.
how listeners can connect with you online.
Okay. Yeah, I'm in beautiful Colorado, US, and I'm in the northeast part in Fort Collins, Colorado. The best way to reach me, though, is through my website. My practice is called Womb for Growth, and that's WOMBFORGROWTH.com.
Okay, wonderful. Well, thanks again, Colleen. And before we jumped on the call today, I mentioned to you when our interview was going to go live, and you said, "Well, it's not really that important. Probably I'm going to have to tell my mom." So I told you we would actually do a shout out to your mom. What's your mom's name?
My mom's name is Fran.
Hi, Fran.
She's going to be so embarrassed.
Sorry to embarrass you, but I thought it'd be fun just to do a shout out because I just thought it was the sweetest thing when I was like, "Oh, sweet, your mom's going to be listening." So, hi, Fran. Thank you for listening to the show today.
Thank you, Lisa.
All right. Well, thanks for being here today, Colleen. It was such a great opportunity to chat about these important topics.
It was an honor. Thank you.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/179. I hope that you enjoyed my interview with Colleen. It was such a great opportunity to be able to chat with her and to connect with her again. As I mentioned, Colleen and I met for the first time several months ago at the Justisse Fertility Awareness Educators Conference. It was held in British Columbia, Canada, and it was a couple months ago. So August 2017. So depending on when you're listening to this, it's definitely a little while ago. But it was really great to connect with her again. And I think, my biggest takeaway from my interview with Colleen is just that connection between your menstrual cycle and your hormonal health, and how your menstrual cycle can actually give you an indication of how well your body is metabolizing hormones and how well your liver is functioning, and also how stressed your liver is. And what I love about Colleen's message is that the first step to improving your liver health and supporting your liver is to stop bombarding it. So I've done a number of episodes where I've spoken about these, so I will link these episodes in the show notes. One of the episodes that I want to draw your attention to is an episode that I did a little while ago on xenoestrogens. And so episode number 65, so if you go to fertilityfriday.com/65, so 65, you'll find the episode that I recorded quite a while ago. And basically in that episode, I list 6 easy ways to reduce your xenoestrogen exposure. And so xenoestrogens is a big topic. It's one of the topics that causes the most stress whenever I do my 10-week program. It's such a big conversation because it's very overwhelming, especially for those of you for whom this is a newer concept, where you may not have realized how the chemicals that we use every single day could be affecting your menstrual cycle. And just the thought of going through your house and doing an overhaul is super intimidating. But I would encourage you to take a listen to that episode, and that's one of the first steps you can do to really support your liver. I've also done a couple of episodes on liver health. So if this topic in particular interests you and you want to learn more about liver function and fertility, recently I recorded an interview with Lisa Leger. So that's episode number 122. So fertilityfriday.com/122. And in that episode, again, we talk about liver function, liver detoxification. We also talk about xenoestrogens and other chemicals. And so if this is a topic that you wanting to kind of dive into more, I would definitely suggest those 2 episodes. But not to worry, if you're on the go, those episodes will also be listed in the show notes page. In addition to that, I really appreciate Colleen's explanation of the different impacts of alcohol, coffee, caffeine on the menstrual cycle and on the liver in particular, and also encouraging that concept of doing basically an experiment, a scientific experimentive one, where you pay close attention to your menstrual cycle, add certain things, remove certain things, and really see how your cycle responds. That is one of the single most powerful tools that I use in my own practice with clients. And I found it to just be incredible, because I think that what happens when you become aware of how your body responds to different things, all of a sudden you can't ignore it anymore. It's almost like you're waking up for the first time and seeing how these different factors can affect your health. And all of a sudden you become more empowered, because then you know, so you can actually make these decisions, and you're coming from a very conscious place about them. So you can know that for me, this is how this affects my cycle. And for me, this is how that affects my cycle. And what's interesting is that for every woman, those things are a little bit different. So for one woman, she might find that gluten, I'll throw gluten under the bus for a minute, but she might find that gluten-containing foods really mess up her cycle and throw off her mucus patterns and all kinds of stuff. Whereas for another woman, gluten is totally fine, but for her, it's coffee. And she finds that when she drinks coffee, it totally messes up her cycle. So what's interesting and important to remember about this process is that it's not the same for everyone. Everyone is highly individualized. And as I mentioned, when I work in my group programs with multiple women at one time, I often have several women that are facing the same challenge, essentially. So they're facing, for example, like gut issues. However, in each woman, those issues are going to present in completely different ways and often result in completely different protocols for how to proceed. So even though there's a lot of similarity between women, there's also a lot of individual differences between women. So I just want to thank you for listening. I really appreciate you being here with me today. I'm going to put a post in my Fertility Friday community about liver health. I want to know what you're doing to support your liver health. Are you removing things? Are you cleaning up your household cleaning routine, or switching out some of your beauty products? Or are you actually focused and doing something in particular to support your liver health? So head over to fertilityfriday.com/community for more information about that. If you haven't got a copy of my free video series, my free Fertility Awareness 101 video series, make sure to head over to fertilityfriday.com/FAM101. That's fertilityfriday.com/FAM101. And so thank you so much for being here today. I appreciate all of you. I appreciate the Fertility Friday community so much. I appreciate all of you for sharing the show with your friends, whether you're sharing specific episodes that someone that will appreciate, or whether you're sharing the show in general. People find me all the time, and I'm just so grateful that the word is getting out there. So I appreciate all of you for helping me to spread the word, and just to really increase our knowledge and awareness about our cycles, our fertility, and all the different things that can impact those things. And so with that said, I want to thank you once again, and as always, be well and happy charting.